Hi, I'm Rick Thompson. I'm a professor of human services and psychology at Austin Community College and practitioner in private practice, and asked to respond to a question about mental health services for diverse populations. And my our definition of diversity would be people of color, people with disabilities, people who are not served as well in sort of in our sort of capitalist society. And the people who are poor, low SES people probably don't get the same kind of services as people who can pay for the services, or people who have good health insurance, and they are relegated to the nonprofit settings, the mental health settings in the community. Those facilities have pretty long waiting lists and time to wait to get in to see a therapist or a psychiatrist for mental health services. Often those services are done in a pretty quick and haphazard way. In our society, we have become very interested in psychoactive medication as the only way to provide mental health service for people. In other words, give them a pill, make sure they take the medication, and they'll get better. And we've sort of minimized, I think, in the public nonprofit or low profit settings, we've minimized the need or the for psychotherapy, and we've maximized the pharmaceutical world. And I think that's not serving our population very well. People sometimes might minimize the need for mental health care. If the waiting lists are long and people can't get in, and they get a 10-minute visit with a psychiatrist or a psychologist or a social worker, they might not want to come back. Often medications are expensive. Often services that they may get one service, and then they'll go back again months and months later. And in the meantime, they're not getting the kind of health care that they might need. We've made some efforts in Obamacare to provide better health insurance and ultimately provide better care for people, but that's changing. I don't think for the better. I do believe that people, diverse populations, need the same kind of care that people can pay for in the private sector, and we just don't have that opportunity, especially in states like Texas, where we're pretty low on providing services for people of low SES or people of color, people who are from diverse populations. So I think we need to make major changes in healthcare delivery, major changes in the world of counseling and psychotherapy for people. And also, I think we need to begin to target children in schools who have concerns, begin to get better counseling services and medical services, and really target those kids early on for help and for care. I think those things are important. Also, I think it's important for people themselves to know when they need some help, when they're not sleeping well, they're not eating well, they're feeling blue or sad or disgruntled. Poverty makes people hungry and angry, and I think it's important to have someone to talk to about those things. Best place to meet people is probably in their school, especially children. That's probably the most I can say. Thanks.